Good morning, friends. I'm Representative Fritz, and I proudly represent the 111th Legislative District comprising parts of Wayne and Susquehanna County. I'll start with a mention of gratitude for all the legislators that have joined us this morning. The strength in numbers approach is certainly the most effective. We're gathered to shine a light on House Bill 986, titled Seeking Fairness in Medical Assistance Transportation Program. For Senator Baker, that's Senate Bill 390, companion piece with the same title. Friends, this piece of legislation is critical for a number of counties across the Commonwealth that provide transportation services. It is highly important to emphasize the number of concerned legislators, as evidenced here. The numerous groups of stakeholders that have expressed dire concern and asked for help before these sweeping changes take effect and completely alter delivery of services to a critical population of our citizens. To that effect, I'll start by mentioning that House Bill 986 has 4 prime sponsors: Representative Hershey, Representative Bernstein, Representative Schneider, and myself. A remarkable number of co-sponsors at 57. Senator Baker's companion piece has nearly 30 sponsors as well, and I found that she'll speak more to that. Aside from those undeniable numbers, we have key groups that have joined together in this initiative. The County Commissioners Association of Pennsylvania, also known as CCAP, the Pennsylvania Public Transportation Association, the Pennsylvania Association of County Human Services Administrators, and as well, the Pennsylvania Transportation Alliance. You see, friends, there's a clear illustration of concern, and I'm proud to stand with my colleagues in both chambers to ask for a delay in implementation of any sweeping changes that will have a negative effect on delivery of services to our residents. Now, before I stand down, I want to express some thanks to Shauna Russell, the Executive Director at Pennsylvania Public Transportation Association. She has just been working very, very hard and diligently in advocating on this matter. So at this point, I'll kindly ask my friend and esteemed Senate colleague to say a few words. Senator Baker.
Thank you, John. Good morning, everyone. Thank you for being here. I want to acknowledge all the members of the General Assembly who are gathered here to shine a spotlight on an issue that is very important to all of our communities. I'd also like to thank all of the officials from the variety of counties who have traveled here to Harrisburg this morning. Thank you for your presence. The fact that you are here demonstrates your commitment and your concern as well. I think what we all recognized last year in an effort to improve efficiencies and reduce costs, the Human Services Code included a requirement that the department seek to revamp the medical assistance transportation program by utilizing a regional or statewide broker. And while the shift will help some counties improve their delivery, the response today from all of you suggests that a one-size-fits-all might not serve or be in the best approach of the Commonwealth. Our legislation gives the Joint State Government Commission 1 year to study the positive and negative impacts of a change, and it prevents DHS from taking any final action for 90 days upon its completion, to allow for a thorough vetting and review of the findings. And whenever we pledge to improve access to health care, the debate is usually framed over affordability, coverage, facility location, and/or capacity. But there is another factor that must come into play, and that is physical access in the form of available and reliable last resort transportation. I represent 5 counties in northeastern Pennsylvania, many of them rural. Many of my constituents travel hours back and forth to their appointments. Getting these individuals to preventative care or needed treatment as directly as possible, we know will save money over the long term. But nothing comes simply or easily in the expensive world of medical assistance. The degree of difficulty rises when we take into account the variable transportation arrangements, and you can all speak to how different they are in our counties. So this approach that we approved last year, while some have suggested it works in several states, others have indicated it's not working. So it's not a theoretical concept. Based on the numerous conversations I've had with my county officials and transportation official service providers, we are absolutely convinced it's logical and financial concerns that they have presented to us must be addressed. So state officials, my message today is state officials should take the time to get this right. If we attempt to force a system that is flawed, it will fail to produce the greater convenience for patients and the cost savings for taxpayers. So affording us time to work out the kinks, to me, seems like the most reasonable remedy. Thank you so much.
Good morning, everyone. I'm John Hershey from Juniata, Mifflin, and Franklin counties. And first of all, I just wanted to thank our bipartisan group of colleagues up here. 57 co-sponsors in the House is something to be proud of, and it's something we're working hard on. And as my colleague mentioned, there often is strength in numbers when we're considering legislation on the floor and through committee. So I just wanted to talk a little bit about the shared ride service in my counties. This serves a very vulnerable population in my counties, and I was just talking to a member that uses it this past Friday, and I asked him what he would do if that service went away. And he uses it for transportation, not only for medical appointments and things like that, but also to help him get to work from time to time. And he said that he would probably walk, and that's not obviously something that he wanted to do. So I just wanted to make sure that we as a House aren't so concerned about cost savings when we fail to consider the human impact that a change like this in the DHS budget would have, and that we're not saddling our vulnerable communities, our most vulnerable communities, with a new program that would cost more and offer less reliable service. As a freshman member of the House, us freshman members, we can often look at these pie-in-the-sky ideals and these programs that we try to go for that'll never work. But I think that oftentimes our communities can be best served by trying to pursue legislation that we can all coalesce behind as a House and that can offer real, tangible impacts for our communities back home. So again, as we've already mentioned, this legislation doesn't stop the implementation of the brokerage program. It simply delays it until we can study the impacts on our communities and see how it affects our most vulnerable populations. So again, I wanted to thank my colleagues for coming up and supporting us here today, and in support of continuing one of the most efficient programs of non-emergency transportation that is a model for many other states across our country. So thank you again, and I'll turn it over to the next representative.
Good morning. My name's State Representative Bernstein. Thank you so much for our colleagues for being here today. And also the ones in the House side that helped is we sponsor this legislation. Representative Nelson, Representative Fritz, Hershey, and Representative Schneider. But also a big thank you, who really led the charge on this is Senator Baker. So Senator, thank you. You did so much of the work on the legislation and putting those together. I really appreciate your leadership on this very important issue. Thank you so much. I think it's so important that when we look at issues, it's important to understand that the needs of Philadelphia, Pennsylvania may be different than the needs of Newcastle, Pennsylvania, which are different than the needs of State College, Pennsylvania. And as we look at things that are done here in Harrisburg, it's important that we understand that a one size doesn't fit all, that there are situations that are different in rural Pennsylvania than one of the largest cities in the United States of America, which is Philadelphia. And that is something that as we representatives and senators work together, I know that we understand that. While some may think that a one-size-fits-all is great across the board, we understand that it's not. And I want to share with you just a brief story about how this would impact folks right here in my community in Lawrence County. I got a call from a woman, and she has some very severe health concerns. And as you know, when you're a state representative, I think the most rewarding part of this job is really trying to help solve people's problems, as simple as that sounds. So what we had was this woman called, and she read about this situation, and she said, my bus is going to be taken away from me. I don't know how I'm going to get to my doctor's appointments. I'm going to die. Well, that was pretty severe and extreme. So I had to obviously talk her off the ledge and share with her, number one, we're not going to let those things happen, and you know, really help her understand that we would help her and work through the process. But my example for that is the lack of communication that happens is we're dealing with people that are vulnerable and oftentimes mentally vulnerable, right? When you're sick or you don't feel well, you may be a little bit more on edge. And us having that communication is important to let these folks know and understand what will be happening for them. And that's why we believe, at least in some of our areas, not all of them, but in some of our areas, that those decisions are best made at the very, very local level in order to allow people that one-on-one and personal connection that people feel comfortable with. Now, there's talk that there's significant savings around this, and I'd share with you, and I know with some of our other representatives and senators, if the governor and his team wants to talk about significant savings, I'm happy to have a conversation. The difference is he may not be real interested in what some of those significant savings are. So no doubt about it, we need to be looking to pinch every penny here in Pennsylvania, but we need to be doing it in a way that's respectful of people. We need to be doing it in a way that ensures that people are treated with respect and dignity. So thank you so much. I have to run to a committee meeting, so I have to step out, but I'll turn it over, I believe, to my very good friend, Representative Pam Snyder.
Thanks, Aaron. Good morning. My name's Pam Snyder, and I am state representative in the 50th District. That comprises all of Greene County, a portion of Fayette County, and a portion of Washington County. My district is 655 square miles. It is huge. And before I was a state representative, I was a county commissioner for 9 years in Greene County. So I know firsthand what it is to manage this program and how important it is to the people in my district. Sometimes good intentions aren't always thought through of how it really impacts Main Street America. This funding flows from the feds to the state, and we as the state like to tell counties, here it is, you manage it. And that's what we've done with this program. And counties have managed it, and they've managed it well. In my world, for my constituents, this is the only means of any kind of public transportation. My senior citizens, my folks that use these services every day will have no way to get where they need to be, even if another entity is managing it, because guess what? They don't like change. The folks that run this program in these counties, they know their constituents. They know the people that they are taking to the doctor's appointments every day. That is important to these folks. So while we all want to be able to save money, first of all, I'm not convinced this will do that. But I too want to thank Senator Baker for her leadership, because we do need to press the pause button. We need to see how this is truly going to impact people in Pennsylvania. And it can't be a cookie cutter approach. What may work in Philadelphia or Pittsburgh won't necessarily work in Waynesburg or Uniontown or Washington. So I am so happy to be a part of this, because as soon as that Human Services Code was passed last year, I started receiving phone calls. Counties know what this is going to do for their constituents. So I'm hoping that we are successful here and that we can press the pause button and that we can get this right, because I truly believe people's lives truly do depend on it. Thank you.
Thank you, Representative Snyder. My name is Representative Eric Nelson, and I'm in the 57th District, which is Westmoreland County. Earlier, we were joined also by Representative Walsh, Dowling. I think Representative Rigby is still here, not just in Westmoreland County, but our surrounding counties. And I think, I too really appreciate the efforts of the senator in being able to be the tip of the spear on this issue, because it is a great example of pace. Here in Harrisburg, pace, sometimes extremely fast pace, results in potentially unintended consequences. And The language for this MATP change was a last-minute insertion in the fiscal code, moments before the final bill. And as Representative Snyder said immediately after the vote, she heard from her county. Well, immediately before the vote, I'm joined today with Westmoreland County's Transportation Coordinator, Mr. Alan Blahovic, and we're texting back and forth. What is this? What is it not? Trying to understand. And I think a core issue, really the primary building block of this bill, is to recognize that this is a sweeping change in Pennsylvania's transportation policy, a biggest change in over 20 years. And both sides of the House, in a bipartisan manner, want to ensure we're going to do it right. We want to tap the brakes a little bit and clearly look at the issue. Are counties inappropriately billing? If they are, I fully recommend we have to change it. But if counties are not inappropriately billing, if our model in Pennsylvania is sound and is benefiting the people, then we should allow choice. And the goal of this bill, in a bipartisan manner, is to allow some hearings, allow some time, because we all know that once a change like this is implemented, it will be extremely difficult to dial it back. And so part of what Representative Snyder and I participated in a meeting, I want to say maybe 3 weeks ago, between both our county transportations. And some of what I learned is that, it's important when an individual in this category may go out, they're not just going to their doctor and returning. A day that they're going to move may be a day they're going to go to their doctor, and then maybe they're going to go to their pharmacy, and then maybe they're going to go and get food. And when we slice up the transportation model, even though those are different and appropriate buckets of billing, we have to understand how this change not only is happening through the flow of federal dollars, but also what's going to happen on the streets of our small towns and communities, particularly in rural areas. So I recognize there's good intentions on both sides of this issue, and that's why it's so important to have hearings, both in the House and in the Senate, to get to the bottom of the line. So Representative Fritz, I appreciate your efforts, and Senator, thank you very much. I'm wholeheartedly supportive of this effort. Thank you.
Good morning. My name is Richard Farr, and I'm the Executive Director of Rapid Transit and Capital Area Transit, and a board member of the Pennsylvania Public Transportation Association. And on behalf of the Pennsylvania Public Transportation Association, we thank the members of the General Assembly who are helping us advance this initiative. We think it's very important. Pennsylvania needs to stop the plan to broker medical assistance transportation program and study the effects brokering will have on the most comprehensive, coordinated, shared ride transportation program in the country. PPTA has looked at several states where brokering has been enacted, but can't find any state where successes in the area of cost or quality of service. Instead, what we have found is mass disruptions of service, increased cost, and reduction in usage. I'd like for just a moment to highlight the Texas brokerage experience. Based on a report by the Legislative Budget Board of Texas, from 2011 to 2015, the Texas Non-Emergency Medical Transportation Program saw its cost quadruple, its complaints triple, and the ridership declined by 50%. Everyone knows that getting folks to their primary doctor and practicing preventative health is key. Key to healthy communities, key to sustainable health costs. Based on the Texas and other state experiences, brokerage moves the needle in the wrong direction. Pennsylvania has the 5th lowest cost per trip while delivering more trips than any other state. That is coordination at its best. By sharing the ride with other human service transportation programs, Pennsylvania can provide significantly more trips to more locations at a lower cost. Today, I'm pleased to announce that I have a special guest with me, Roberta Simmons. We know her as Bobby back in York, and her husband Roger's with us as well. Bobby, you want to wave over there in the corner for me so everybody knows who you are? Thank you, Bobby. 20 years ago, the rural program, Persons with Disability, was enacted, and Bobby was the very first rider under that program. I'm also pleased that she's a Rapid Transit customer. She has been a lifelong advocate for people with disabilities. I know this because she keeps me in check every step of the way. She's really diligent in her work. She works tirelessly to ensure everyone can participate fully in life and fully in their communities. She has shared with me her fears that she will see from this program the cost increases and the service reductions to the members of the community who need transit most. And so she has been tirelessly talking to me about this effort, and I thank her for that. We cannot allow the brokering of medical assistance transportation program to dismantle Pennsylvania's shared ride transportation system. We need House Bill 986, and we need it now. Thank you.
Happy to field any questions. I appreciate it. We get Rigby, Gobbler, Megan Schroeder have joined us. I appreciate that very, very much. Again, strength in numbers. Truly appreciate it. Friends, any questions? Well, that will stand down. We appreciate everyone's attention this morning. Thank you very much for being here.